Good afternoon. My name's Louise Sellars. I'm one of the Rehabilitation Network Managers at the Agency for Clinical Innovation, and I've been invited to speak today at the Stroke Recovery Association conference about the Agency for Clinical Innovation and specifically about the rehabilitation and the stroke networks. I'd like to start by acknowledging the traditional owners of the lands that we're all meeting on today, understanding that we're all dialing in from all parts of Australia for this conference. Pay my respects to elders past and present and extend that respect to other Aboriginal people here today. So just to give you a little bit of background as to who ACI is, ACI was originally established in 2010. Some of you may remember in 2008, the Garling report was published, and that really highlighted some big changes were needed in the area of healthcare in New South Wales. And one of the key findings out of that report was that there was a greater need for clinician input, as well as consumer input in the way that healthcare was delivered in New South Wales. And that led to the establishment of ACI, which was originally called the Greater Metropolitan Transition Task Force, and that evolved over time into ACI. So the vision of ACI is to create the future of healthcare and healthier futures for the people of New South Wales. We're the lead agency for innovation in clinical care and bring together patients, clinicians and managers to support the design and implementation of innovation in healthcare. So we're a pillar of New South Wales Health. We're not the ministry, we sit separate from the ministry, alongside the other pillars of New South Wales Health, such as the Clinical Excellence Commission, the Cancer Institute and the Bureau for Health Information. So what's different about ACI? Well, we're divided into 40 plus clinical networks and 8 clinical streams. So I'm here today representing the Rehabilitation Network, which is my substantive role, as well as the Stroke Network. Some of you may be familiar with the wonderful Kate Jackson, who has been the Stroke Network Manager at ACI for many years. Sadly, Kate has left us just this week for another role. So I am here presenting on her behalf today. So the core functions of ACI are the development of clinical guidelines and models of care, patient engagement and co-design, clinical evidence generation and mobilisation, clinical innovation and research, clinical redesign, implementation support, and evaluation and capability development. And we do that, as I said, across 40 different clinical networks. So if you can think of a network related to a particular medical condition or a body system, we've pretty much got it. So talking now about the Rehabilitation Network. So we were established in 2011. We were one of the first networks under the new ACI, and currently we have over 700 members, and we're led by a 14-person executive committee, and that includes the Chief Executive Officer of the Stroke Recovery Association, Michelle Sharkey, as well as medical, nursing, allied health and consumer representatives. Our co-chairs may be known to you, Dr. John Estelle, who's the Head of Department for Rehab at St George Hospital, and Sandeep Gupta, who's the Head of Department Physiotherapy at Balmain Hospital. And we have stakeholder relationships with a lot of external bodies, the key ones being AROC, which is the data registry for rehabilitation outcomes across Australia and also New Zealand, the Stroke Foundation, the New South Wales Ministry of Health, and we also do an increasing amount of work with the NDIA, the National Disability Insurance Agency, over the last couple of years. The Stroke Network was established initially in around 2003. They also have over 700 members, and they're led by a 20-person executive committee, including medical, nursing, allied health and consumer representatives, so similar sort of composition to the Rehab Network. They have 3 co-chairs. So they've got a medical co-chair, Dr. James Evans, who presented earlier in this conference about the rollout of telestroke, Kylie Tastula, who's the Neurosciences CNC at RPA, and Claire O'Connor, who some of you may remember was the former Rehab Network Manager before I started in the role, and she's now Head of Allied Health at South Eastern Sydney LHD. The key stakeholder relationships for the Stroke Network are the New South Wales Telestroke Service, the Stroke Foundation, the New South Wales Ministry of Health, and eHealth, which is another pillar within New South Wales Health. So in terms of the rehabilitation network and its current priorities, we're working on a number of large pieces of work at the moment. So the first one of those is the implementation of the principles to support rehabilitation care, which is our model of care, which outlines best practice principles for the delivery of rehabilitation in New South Wales. And so we've developed an accompanying framework to support that implementation, and we're currently piloting that at a number of sites. Another big piece of work we're working on at the moment is addressing discharge delays in relation to NDIS. So I'm sure you're all familiar with the patients who have had a prolonged length of stay in rehabilitation because they're waiting for their NDIS package to be approved, they're waiting for their home to be modified, or they're waiting for suitable accommodation to become available under NDIS. And we're really trying to focus in on those issues so that patients aren't left waiting in hospital for those prolonged periods of time. Another piece of work we're working on at the moment is supporting the COVID-19 response for rehabilitation. So we have a community of practice that was established 12 months ago now. And we've developed a large number of pieces of work and advice to support the rehabilitation clinicians in their delivery of care during COVID and into the post-COVID period. So speaking about the stroke network structure, so this is a very busy slide, which I guess probably goes to the core of how busy that network is at the moment. So they have 4 key areas of focus. So the data and benchmarking is a really key part of that network's work. They're in the process of exploring an interim data solution and electronic quality registries to make sure that data is collected and to focus on a fully automated data system moving forward. Reperfusion and telestroke, massive area at the moment. So that group is looking into the development of a mobile stroke unit of care and an implementation strategy to support that. An ECR bypass project, which is a project group focused on the development of a metropolitan Sydney bypass model of care, and also telestroke implementation, which you heard Dr. Evans speak about earlier. Professional development is also a really key part of the network's activities. They focus on nursing education for relevant to stroke, virtual reality education, which is becoming more and more important in this world of telehealth, and also the introduction of the Oxford Cognitive Scale, which is a UK-based cognition tool, which is currently being piloted and adapted for the Australian context. There's also the Stroke Unit Access and Care Group, which looks at clinical collaboration and also outcomes across that group. There's multiple communities of practice that support all of these projects, particularly the rural telestroke project officers and the coordinators. Complex case review, which looks at any sort of quite significant adverse events and identifies opportunities for improvement. And also the medical stroke leads also have their own community of practice. So in terms of how you can connect with us at ACI, you're very welcome to join a clinical network. We welcome consumers and clinicians. The more the merrier. We do try and involve our consumers and clinicians in our activities as much as possible and send out regular information when that arises, as well as the opportunities to participate in research, which is led by major research institutions. Attending network events. Our events have been a little bit light on the ground over the last year because of COVID, but we are starting to increase our face-to-face events, and we are also continuing to do a fair bit in the virtual space. You can sign up to Clinician Connect to find out about our key network initiatives, and you're able to do that at ACI website, which is aci.newsouthwales.gov.au. And you can also follow us on Twitter, and that Twitter account is updated usually once or twice a day with relevant key documents that are released, any events that are happening, and relevant things that are happening in the media that impact onto ACI. So thank you again for providing me the opportunity to speak with you today. I'm sorry I wasn't able to be there with you in person, and thank you to the Stroke Recovery Association for continuing to work so collaboratively with ACI. We really do appreciate your input and your partnership. Thank you.